Hi, my name is Eileen Torres. This week I will be doing assignment number 4. The movie that I picked was Beautiful Mind. The reason why I picked this movie is because I believe that it's a very, very interesting and fascinating movie that not only captivates the minds of the people that have watched it, but it's very, very intrigued and actually this way was one of the reasons why I decided to pursue it, a career in a field of psychology, because I believe that psychology is not only very important in our society, but it's actually a very, very fascinating career and field. So in this movie, the main character is John Nash. This movie is actually a biographer movie. It's based on a true story. This movie portrays the reality of a brilliant mathematician who started having symptoms of schizophrenia at the early 30s. He started having delusions, hallucinations, confusing thinking, and at the beginning of this, he didn't know what was going on, so it was very hard for him to deal with this situation, act as well for the people that were around him. So he had a lot of challenges that he had to overcome in order to be able to go on with his life. This movie, Beautiful Minds, he is a very, very interesting movie because this movie not only managed to explain and to portray the life of someone suffering from schizophrenia. Furthermore, this movie has a unique way of showing an insight of how schizophrenia feels like to people and from a patient's perspective. Actually, people suffering from schizophrenia like Nash, they live their reality. They don't see life the way we see it. They see life and they see the world in a different way. They have a reality of illusion different than what we have. They actually believe that their illusion is actually real. They believe that their hallucinations and their visions, their voices are part of their life because they feel it and they see it. And actually, when you feel something and you see something, it's real for you. And the most challenging thing about all this is that he is seeing this, but other people are not seeing. So this disease, schizophrenia, is not only very hard to deal with, but it's actually very hard for the patient to understand why this is happening and why this is going on with them. So in a sense, I can say that we all fabricate our own realities. We all have our own way of seeing life. But indeed, in this case, is for the person who has schizophrenia is quite different because they don't only creating this on the head. They're not thinking that this is like this, or they don't have a perception. They actually seeing things. They actually seeing what they believe. So it's even harder for them to treat that and to live without those influences affecting their life. Nash, who is the main character suffering from schizophrenia in this movie, he is able to build his own reality. He lives in a complex world full of abstract meanings and symbols, which make invisible to the other person, to the person who is not seeing. But what I learned on this movie is that lack of visibility, or meaning that if you cannot see something doesn't mean that that is not there. And that's one of the main issues that some people have you know, when dealing with the person who has schizophrenia. And some people cannot understand that this person actually are seeing and are living what they are saying they are seeing. So it happens to be that part of Nash reality was not only secret, but he didn't have much balance when dealing with this type of problems at the beginning. These personalities that he was seeing, like in the room, in the classroom, when he was walking in the street, these people, they were actually becoming not only part of his daily life, but at the beginning, they were interference with his normal behavior, and he was not able to perform the way he was used to perform before. It was very challenging for him, family, to understand what was actually going on with him. But the most difficult part for him was to remain organized and to be able to separate between what was real and what was not real. That was, I believe, that it is one of the most challenging part of schizophrenia. And if you, the person doesn't have the right treatment and the right guidance, it can be very, very confusing. So now I will explain what are the DSM-5 when diagnosing schizophrenia. The person should portray 2 or more of the following symptoms for a significant portion of time. For at least 1 month: delusions, disorganized speech, disorganized or catatonic behavior, or some negative symptoms. Nash, he showed more than 2 symptoms. He had hallucinations, delusions. Sometimes he will become catatonic, meaning that he would feel like he couldn't move or do anything. And that's something that I read. It's not actually portrayed in the movie, but I read on the internet in his biography, showing how hard it was for him, you know, deal with this feeling. And sometimes, like, I believe that even the anxiety would make him feel catatonic to the point that he couldn't even move or, you know, express what he was feeling. Another symptom is social and occupational functioning have declines since the first symptoms occurs. So that's what happened with him. When he started portraying the symptoms, his performance in his job, because he was a mathematician, he was a professor at a university, his performance started to become poor, because he was actually seeing these people at this class. They were actually telling what he should do or what he shouldn't do, and that made him feel very uncomfortable and very insecure, and he lost how can I say, he lost confidence in himself, and because he was confused. So of course, this type of symptoms are going to decrease the performance, any type of performance, professional performance, or it will actually interfere directly in the daily tasks of the person that is suffering from schizophrenia, especially when it's not treated. So other signs are signs of disturbance for at least 6 months, at least 1 month duration for delusions, hallucination, disorganized speech, disorganized or, like I said, catatonic behavior, during the remaining time, either negative symptoms or other symptoms in a very, very strong or mild form. Schizophrenia has positive symptoms and negative symptoms. When the person is showing positive symptoms, the person may believe that thoughts that are not in his or her own mind has been placed by some type of telepathy by an external source. This is called thought of insertion. For example, a woman may believe that the government has inserted a computer chip or into his brain, or a guy may believe that some forms of aliens has, like, while he was sleeping, abducted him and put some type of chip, or are performing some type of experiments on them, you know, or are working with their mind, some type of stuff like that. That's why they believe that they act in that way. That's why they justify and why they're behaving the way they are behaving. So that is one of the positive symptoms that the person can show. A person also believe that the thinkings and the behavior that they are actually performing are somehow broadcasted to the mind, are somehow transmitted to their mind by telepathy or other way. They actually become very paranoid. They believe they start having feelings of persecution, or they're being followed, or stuff like that. Positive symptoms, they are mainly delusions, hallucinations, and then we have, the negative symptoms that are followed by abolition, allosion, anhedonia, and they affect you socially as well as they affect you socially because they are not only thought. You actually see what you believe is happening. We actually the person suffering from schizophrenia, in this case now he has this type of symptoms as well. He has disorganized symptoms, you know, disorganized behavior sometimes and disorganized speech. That's a very peculiar symptom of a person suffering with schizophrenia. Also, we can say that a person with schizophrenia, there is not actually a research that explains why a person can end up with schizophrenia or is born with schizophrenia, but there are some genetic factors that affect that. There are some genetic factors that are very strong, and it's proof that a person who has somebody in their family with schizophrenia have a chance of becoming ill with the same illness. So that's one of the reasons why a person may become schizophrenic with time. A good deal of research supports the idea that schizophrenia has a genetic component, like I said before, and the evidence is somewhat more convincing from behavior and genetic studies, largely because they have been well replicated. Many the researchers have performed some molecular genetic studies, and still even though they have some proof that it can be genetic, they still need some more reassurance of, to be completely sure that that's one of the main reasons. But so far now we have some evidence that genetic is a reason why schizophrenia can appear, or a person can become ill with this disease. The family that has some type of history of schizophrenia usually has been shown that is actually genetic, because in some cases we see that there is a pattern of other people in the family suffering from the same disease later on, and being affected with the same symptoms later on. There are actually other people that become schizophrenic and we don't know why, because there's no history of schizophrenia in their families. But in mostly many cases, there are a lot of researches showing that schizophrenia has a big part of a genetic part. So one of the main reasons I believe that the person can become schizophrenic is because the genes are on the because they have those genes. So coming back again to the movie, one thing that I love from this movie Beautiful Mind is that how John is able to live and perform his daily task, you know, by being able to deal with their personalities. He received treatment, therapies, and as well as medications that help him cope with that. So he started, the people that he was seeing, the voices that he was hearing, he started to integrate them in a way that he was able to perform his work. He became a really, really good professor, and later on he won a Nobel Prize, because that was something very, very beautiful what he did. That's why the movie is Beautiful Mind, because he was able to integrate all these all these people into his daily life, and he was able to identify and separate what was real from what was not real. And that was and that's one of the reasons why psychiatrists and therapies are so important to help those people that have those type of disease and disorders, because our job is to help them go on with their life and to help them deal with that, and as well as treat their symptoms and make the symptoms less aware, and make a way that they can be able to perform the daily task, as well as perform what they are supposed to perform every day. So another thing that I believe is very important to, I believe, and I read, and I think I should point, is that schizophrenia is actually sometimes very hard to identify, because at the beginning, depending on the background of the person may be misled to other path, and where the person is not going to receive the right treatments or the right guidance. For example, there are some cases where people that are hearing voices, they believe that they're actually seeing spirits, or they're hearing a spirit, or things that aren't there, which is very difficult, because the person actually is suffering from schizophrenia, but the person is misled to believe that she has a spiritual problem or a spiritual case. And these people, sometimes they are not treated, and sometimes that's why some of these people, they become suicidal, and they later on, you know, they are lost because they didn't receive the right guidance. That's why it's so important for our community and our society become aware of what, you know, how schizophrenia may work and works, and how can we help these people that are suffering from this disease, and how can we identify this disease. The type of therapy that I will use with Nash in order to help him follow and go with his life would be solution-based therapy. The reason why I will choose this type of therapy is because this type of therapy, the main effort is to understand and to educate their clients on how to work and how to cope with their diseases. A solution-based therapy has the capability of orienting and helping clients to recognize problems that are affecting them and their family. In this case, it will really benefit Nash because he will understand what was going on with him, and he will be able to learn how to deal with that without the need to focus only on the disease, but instead focusing on the solution. And the reason why several therapies are using solution-based therapy as their main treatments is because it's not only a unique methodology, but they're the best in creating different resources to conceive and to help solve a problem and build an effective treatment plan that will create a good relationship between the therapist, the family, and the patient, which is really, really important in this type of cases. Solution-based therapy will base mainly on the solution of the problem and not in the disease, and will actually educate the family as well as the patient on how on what are they supposed to do. So a solution-based therapist, he will create a map, he will create an action plan where he is going to be able to note what are the problems that are affecting her client, and he's going to be able to create what is the plan action that is going to help this client, her client, overcome the disease and the problem. So in this case, I believe that having this type of therapy together with medication, the proper medication for schizophrenia, will help Nash overcome and learn how to deal with his disease, as well as to live a normal life, and will help balance his family, and he will help him go on and be successful in his job. So that's the one of the main reasons why I choose this type of treatments, because I believe that sometimes when we overlook so much the problem, we forget about the solution. And what I love about this approach is that this approach focuses on coping strategies. It focuses on the solution instead of the problem. So actually, I used the book for this week. I used the resources. Actually, for this week, I also did research online about the schizophrenia to understand better. I use this book as well. It's called Personality Theories, where they explain a lot about schizophrenia and how a person with schizophrenia may suffer when they are not treated well, and what are the symptoms that the person portrays. So it was very fascinating for me doing the research and learning more about this disease, and learning more about how I can be helpful and how I can guide someone who is suffering for this type of disorder. Actually, watching this movie was actually very refreshing for me, and make me aware of how important I can be for my society, and what a difference I can make in society by being a competent therapist, and by giving the right help and the right guidance. And actually, how important it is to have a good guidance in order to succeed. So how we see Nash, he succeeded in his life. He became a great professor. He was able to cope with his disease, and he actually is a winner. And that's why I believe that he won the Nobel Prize. And actually, something that I learned too is that the person suffering from schizophrenia not only needs our help, but they also want and they need to feel the need to be helped. Because when a person is able and willing to do what is necessary for them to be cured, or at least to be able to have a better life, it makes our job better. And of course, the results at the end are going to be better. So now I have finished my video. My name is Zelin Torres, and I hope that I cover everything that was asked in this week. And I thank everyone that helped me do this video. And I see you guys next time. Thank you.